Steven. I'm from Chino Hills, California, and I will be getting the 360 high-def liposuction procedure. So I'm getting this surgery because 10 years ago, I had an appendectomy surgery, and it went bad. Since then, I've been working out really hard, doing diet plans, and I just really couldn't get to that next level that I wanted to. So I'm really active on a day-to-day basis. 4 or 5 times a week, I'm hitting the gym, and I'm eating healthy, super active person overall, and I felt like high-def liposuction was the next step. So initially when I was doing my research, I was just researching liposuction, how to tighten up the midsection. Eventually on YouTube, I came across a video that Dr. Emmer posted, and the results from his video were just phenomenal compared to all the other videos I've seen. I had consultations set up along with Dr. Emmer's, and I went to Dr. Emmer's consultation first and just ultimately had a good feeling with him. So it made me feel really comfortable and trusting him with the procedure. Again, he answered all my questions, and I had a ton of questions to ask him. That confidence about him really was nice. And he spent a lot of time with me kind of going through precautions and what to expect after, the type of work that he would do, and I just had an overall really good feeling about him. I decided not to go on any other consultations that I had lined up, and I just went with Dr. Emmer.
When I first met Steven, I knew he was a great candidate for high-definition body sculpting. He's a very athletic younger male. He has really tight skin. He works out and diets regularly. These are the best candidates for a body sculpting procedure. What he needed, though, was really different. He didn't just need traditional approaches where fat is reduced, even though he had problem areas in his stomach, his chest, and his arms and lower back. He really wanted an athletic look. Why people come to me is because they want a true full body transformation. Our plan for surgery with him was to really do a full high definition surgery. We were going to remove fat in his stomach, his arms, and his chest, including his back, and give him a real tight look. So our plan was to sculpt out his six-pack, his chest, and his arms, and then use the fat to really build out an athletic look. Lift his chest, define the roundness in his shoulders, use some of the fat in his upper buttocks, so when we remove the fat of his back, it gets a nice curve and a lifted buttock look, and also tighten up his waist by bringing in the fat in his back. One of the unique things we do for male chests is lifting the nipple and removing the breast glands. In a traditional approach with men that have fat in their chest, most doctors just do a little bit of liposuction and remove the glands. This often leaves the chest very flat and also with an indentation around or under the nipple after surgery. Men don't want that. They want an athletic look. They want a squared off chest. They want it to look tight and lifted and to be contoured with their stomach and their arms. So what we do that's different is we not only remove fat in that area, we then take that fat and inject it to the upper part of the chest to lift the chest. We remove all of the breast glands so that the muscle and the skin are attached to each other, and then our plastic surgeons come in and lift the nipple up and put it tight against the chest so that no indentations and no deformities will be formed after surgery. Why would you go to me over any other doctor that does lipo? Well, myself and my team pride ourselves on doing these astounding body transformations. We don't just remove fat, we tighten the skin, we sculpt out the muscle, we fix botched surgeries where there's indentations or scar tissue or irregular scars. We also take fat, and we're pioneers in the fat harvesting, where we take fat, we wash it gently, we filter it, and we add growth factors and stem cells, and then use that fat to lift and contour the body. In Steven's case, he really wants to be a young guy that's fit and athletic. He looks ripped when he goes to the beach. He feels great after his workouts. Then when I saw him in the consult, I knew that's exactly what he would look like after he had our body contouring procedure, and then lifelong he would have a new sculpted appearance that he can continue to define on with his great exercising and dieting.
So my experience with Dr. Emmer was, I would say, pretty good overall. The healing process, I feel like I've healed pretty fast. Post-op, I did a hyperbaric chamber. I did about 10 to 12 sessions, and I think that really helped the recovery process. The lymphatic massages, that really helped. So I feel like my results really are good right now. So it's been 3 months, try to get in the gym when I can and just be consistent, do some workouts, do cardio, eat healthy, and
just doing that seems like it's really coming along. I feel like that was the best surgeon that I could have picked. Just so happens he was the first consultation I had in regards to these type of surgeries, so I'm glad that I picked him, definitely, for sure.